I'm Dr. Mudit Khanna, Senior Consultant Orthopaedic Surgeon at the South Mumbai unit of Wockhardt Hospitals. I have special interest in joint replacement surgeries for patients suffering with advanced osteoarthritis of the knee. But I also have a very keen interest in joint preservation, especially in patients with early stages of arthritis. Osteoarthritis is an extremely common disabling condition that affects a very large proportion of our society. While treatment options for advanced stages of osteoarthritis are well known in the form of joint replacement surgery, there is still a lot of debate about what can be done for patients who suffer from early stages of arthritis. Essentially, osteoarthritis or loss of cartilage between the bones can be divided into grade 1, grade 2, grade 3 and grade 4. Essentially, grade 4 arthritis means complete loss of cartilage requiring a knee replacement surgery. But treatment options for early stages of arthritis, especially patients who suffer from grade 1 or early osteoarthritis or moderate stages of arthritis, specifically grade 2 or grade 3, for these subset of patients, we haven't had very clear sort of interventions available until now. So most patients who suffer from pain in the knee and are diagnosed with early stages of osteoarthritis have so far been recommended only sort of lifestyle modifications and physiotherapy, weight loss, etc. But no real intervention has so far been available to help delay the progression of osteoarthritis, or let's say any intervention that could potentially reduce the chances of these patients requiring a knee replacement in the future.
A journey through the silent echoes of osteoarthritis in India. A tale of resilience, pain, and the promise of renewal. India, a nation grappling with osteoarthritis. The prevalence of symptomatic osteoarthritis has surged dramatically, from 23.4 million in 1990 to a staggering 62.3 million in 2019. As the population ages, the burden of osteoarthritis is set to soar exponentially. Nearly 80% of individuals experiencing knee pain are affected by osteoarthritis. Shockingly, knee osteoarthritis sees a tenfold increase between the ages of 30 and 65.
In the past decade or so, a lot of interest garnered around biological treatment options, and a lot of research has been performed on these biological treatment options for the management of arthritis of the knee. So what is biological therapy for osteoarthritis of the knee? Biological therapy for osteoarthritis includes a number of treatment options that aim at reducing pain, improving function, and that carry the potential for regenerating cartilage. So if you look at studies that have been performed in the past 10 years or so, we will find a number of publications on the use of platelet-rich plasma or PRP, growth factor concentrates, which is essentially a concentrate of growth factors that can be injected back into the patient's knee to help regeneration, reduce pain and improve function.
In India, over 62 million individuals suffer from osteoarthritis. A third of them, around 20.52 million, reside in metros and big cities. As per TOI, traditionally arthritis was rare in those under 50. However, recent surveys from 5 hospitals reveal a new reality. 26% of patients are under 40, while 74% are over 40. Every year, 2 lakh Indians undergo knee surgery, a testament to our pursuit of a pain-free tomorrow. Even treatments like total knee arthroplasty can fall short. Up to 14% of patients undergoing TKA surgery remains dissatisfied with their outcomes post-surgery.
I'll be talking today about one of these biological treatment options, which is autologous growth factor concentrates that we have been using for a while now. Now, what are these autologous growth factor concentrates and how do we perform these procedures? So essentially what is done is that the patient's own blood is collected. So it's a completely autologous procedure, which means there is nothing that is added from outside. There's no pharmacological component that is really going into the patient's body. So the patient's blood is collected, and this blood, especially rich in platelets, is also rich in a number of growth factors that have the potential of healing, the potential of regeneration, as well as the potential to reduce pain and inflammation. So these growth factors are separated from the patient's own blood. These are concentrated, these are activated, and then these activated growth factors are put back into the patient's knee where there is wear and tear happening, with the hope, with the expectation that these growth factors will help in regeneration as well as in reducing pain and inflammation that patients have been suffering from because of the existent osteoarthritis in their knees. One of the other advantages of using regenerative therapy in the form of growth factor concentrates is that there is minimal downtime. They can be done as an outpatient procedure. They are minimally invasive. All they need is an intra-articular injection to put the growth factors or the growth factor concentrate back into the knee. They are potentially safe because they are extremely safe because they are autologous. That is, they're drawn from the patient's own blood. A recent study comparing effectiveness of growth factor concentrates versus hyaluronic acid showed significant improvement in both pain and function, which was better in patients who received growth factor concentrates. This improvement was sustained for up to 11 months. These biological therapies therefore hold a significant promise and are something to be watched out for in the time to come.
India stands resilient, seeking renewal and promising brighter tomorrows for those affected by osteoarthritis with OsseNext. OsseNext can be prescribed in shoulder pain, tennis elbow, AV and hip 2A, knee osteoarthritis, plantar fasciitis or Achilles tendonitis, chondromalacia patella. OsseNext is next generation therapy, non-surgical, safe option, no risk of contamination, excellent stability, no platelet loss and high concentration of growth factors. Simple protocol and minimal operator dependent variation. Completely acellular, reduced risk of pain and inflammation.